All right. So let's talk about substance use and abuse. We're going to talk about addiction in general. We're going to talk about um, substance related treatment as well as what makes it effective. So, how addiction forms. It's not a one size fits all by any stretch of the imagination. It can be due to it can start with just taking it casually, and then there's some sort of psychological dependence that forms. It can be that something is missing in an individual's life and they're seeking the substance to kind of fill that hole. As well, it can be that an individual starts taking the substance voluntarily and the physical dependence on it happens quickly, where an individual really either they enjoy it or their body craves it pretty quickly uh, after a few or several times of taking the substance. But there's plenty of times where it's a combination of the two, where it happens to be both a psychological as well as a physiological addiction. So yes, individuals initially take the drug voluntarily, but I don't think anybody takes the drug initially with the goal of becoming addicted to it, right? And so chronic substance use can permanently alter the neural structure. So because it alters your brain chemistry, and especially when it comes to the prefrontal cortex that's associated with decision making and judgment, the individual then, with enough and consistent uh, usage of the substance, they can become driven to use the drugs or alcohol, making it difficult to stop. So it may start off as a psychological addiction and can turn into either strictly a physical dependency. They want to stop, but they can't. And or it can be both, or it can just be psychological. There are a number of outlets and ways that individuals become addicted to a substance. So it happens between about 40 to 60% of individuals whenever they seek treatment and they are sober for a period of time. A good bet is that half of those individuals will relapse. Okay. Now, when it comes to treatment related to substance use, this includes behavior therapy, which will help the individual, can help motivate the individual to participate in the treatment program and teach them strategies to deal with cravings and prevent relapse. So medication uses, especially whenever you're first coming off of a substance like alcohol or narcotics, specifically opioids, there are certain medications used to safely detox and alleviate the withdrawal symptoms as a result. Because when it comes to those benzodiazepines and those anti-anxiety agents and those that depress central nervous system activity like alcohol, these will help prevent seizures and agitation that often occur, and it will help prevent the reuse of the drug and again manage those withdrawal symptoms. Now, the goal of is to help overall is to help a person addicted to a particular substance stop compulsive seeking behaviors, and it does require long-term treatment, and multiple months is encouraged. But again, affording that mental health treatment and those rehabilitation clinics can get pretty pricey, which is why not a lot of individuals stay long enough to receive the adequate tools they need to safely reintroduce themselves into the world. Okay, so again, what makes the treatment effective? As mentioned, at least 3 months is recommended for a person to achieve a positive outcome, and there are a few factors involved that make it even more effective. So there's the holistic treatment that whenever you meet with the counselors and the associates at the clinic, they address multiple needs, not just the drug addiction. They're trying to get to the root of the problem and navigate that more so to help you with, I guess, the compulsion to take the drug whenever you're released from rehab. And often in rehab, you'll have group therapy sessions, and I've already kind of explained how those operate, but you're in there with other individuals who are addicted to substances. It may be the same substance or a mix of different substances, but the goal again is to promote affiliation and decrease isolation and hear other people's perspectives and what they're going through and what they've gone through in their life when it comes to abusing that particular substance. And parental involvement is really important when it comes to individuals who are addicted to a substance and going through rehabilitation, because it's correlated with a greater reduction in use by teen substance abusers.